Hello, so today we will discuss respiratory, cardiac, and musculoskeletal pediatric disorders. So epiglottitis, inflammation of the epiglottis. So what is the function of the epiglottis? It is a flap of tissue that covers the opening of the larynx to keep food and fluid during swallowing. So it is caused by H. influenza. Epiglottitis enlarges, causing obstruction. So those are the reasons why we have epiglottitis. So how do we assess if someone has this? Drooling, dysphagia or inability to swallow, difficulty rather, dysphonia, difficulty speaking, redness, and inflamed throat with large cherry red epiglottitis. So how do we diagnose this? Ineffective airway clearance related to inflamed throat. Ano na lang. Hyperthermia, because again this is a inflammation, so it causes temperature to be increased. So that's one that we have to learn. Medical management for epiglottitis. So in every disease, we really need to know how are we going to treat this, you know? So endotracheal tube, endotracheal intubation tracheostomy. So endotracheal pa jud, intubation tracheostomy. For severe cases na siya. So, after intubation, monitor closely and maintain a patient airway, suctioning, provide oxygen therapy, and we also give antibiotics and anti-inflammatories, which are steroids. So, this is the picture of the endotracheal intubation tracheostomy. Okay, so we're gonna write that. Intubation tracheostomy. So, and the next thing we have to remember is kailangan ta mag-give og anti-inflammatories. After intubation, monitor patient closely and maintain a patent airway. So, i-maintain na to ang patent airway. Suctioning, provide oxygen therapy, antibiotic, anti-inflammatories, which is steroids, and then boom. Anti-inflammatory, which are steroids. Okay. Cystic fibrosis, this is something na ako na-learn grade 12, na this kind of a disease, but this is a hereditary disorder characterized by lung congestion. There is excessive build-up of mucus because of the exocrine glands is dysfunction. So, ang exocrine is sweat glands, basta pagawas daw siya. And endocrine are those that is built inside. Chronic multisystem disorder, autosomal recessive hereditary disorder. Autosomal recessive meaning it is something na kailangan na ay both parents' allele. So, child inherits the defective gene from both parents. You are correct. So, mucus is thick, tenacious, and copious, causing obstruction. Lung involvement. So, the cystic fibrosis has 4 organs that is mainly affected. We have the lungs, the pancreas, the sweat glands, and unsa pa ang intestines. So we have lips pneumonic. Lung involvement, what will happen to mucus? Oh my gosh, I hate this. Sorry, Lord. What will happen to mucus secretions sa lungs? Pilit kayo mag-accumulate, dili ma-expectorate kay Kung dili siya ma-expectorate magka-infection, then maglisod siya ginhawa. So, lung involvement, excessive pooling of secretions. Bronchial and bronchular obstruction. So, what does excessive pooling of secretions mean? Grabe ang secretions nga ma-form. Bronchial and bronchular obstruction, generalized hyperinflation and atelectasis. Altered O2 and CO2 exchange. Wala ko kasabot. What's excessive pooling? So, excessive nga stay sa mga secretions. Bronchial and bronchular obstruction. So, ma-constrict ang bronchioles. Dayon mag-hyperinflation and atelectasis. What does atelectasis mean? It means lung collapse. So, ma-altered ang oxygen and carbon dioxide exchange. Varying degrees of hypoxia, hypercapnia, and acidosis. So, fluid and electrolytes. High susceptibility to bacterial infections. So, primary observation nato nga buhaton is recurrent respiratory infections due to chronic pulmonary insufficiency. So, as we can see, makakita tag clubbing of failures. Ang sige, ingon dire? Recurrent respiratory ang infections due to chronic pulmonary insufficiency. So, insufficient man ang iyang pulmonary, no? Magkabalik-balik siya infections ani. So, non-productive dry hacking cough. So, when we say hacking cough, it means non-productive DI. So, wala siya plema, di ba, ang non-productive? Pero anong daghan siya plema man? Say pasabot. Comment down below. Audible wheezing. Dyspnea. Barrel chest. So, muna ang itong picture sa barrel chest. Clubbing of the fingers. Rails. Wheezes. Thick tenacious secretions and cyanosis. So, iyahang mga extremities okay. Blue na siya. Pancreas involvement. So, degeneration and fibrosis. What does fibrosis mean? Comment down below. Inhibition of pancreatic enzyme and secretion. So, na-inhibit, na-stop ang enzymes. So, impaired absorption of fats, proteins, and limited degree of carbohydrates. If walay absorption of fats, proteins, carbs, muniwang ang bata, kay pilit ang enzyme. Yeah. Impaired absorption of fats, proteins, and limited degree ra pod ang carbohydrates. Primary observations. So, meconium ileus, bulky, foul-smelling, fatty stools, distended abdomen, failure to thrive. Failure to thrive kay dili man makatarong og work ang pancreas kay lagi na-inhibit ang pag-excrete sa mga pancreatic enzymes such as the insulin. Are there any other nga pancreatic enzyme? So, impaired absorption of fats, dili ma-absorb ang fats, and limited degree ra pod ang carbohydrates. What does meconium ileus mean? Very thick ang meconium, so resulting to constipation, nag-obstruct siya dire. So, diri ra nagapundo ang meconium. Bulky falls distended of the failure to thrive. Small intestine involvement, absence of pancreatic enzymes. So, walay amylase. Enzymes man ta, dili man ta. Unsa day ang kuan di ay insulin? Pancreatic product. Kay ang enzyme man kay ang amylase, trypsin, o lipase. So, unsa kanining amylase? Made of, gikan di ba ni sa tong laway? Trypsin, this is a type of protein, di ba? Enzymes are the ones that make things faster to kanang breakdown, catalyst sila. So, impaired production of fat, impaired ang absorption, pag-absorb sa fats and proteins. So, sign, mupilit ang tae. So, sa bowel, steatorrhea, loose, bulky, frothy, and fatty stools because dili man ta maka-absorb og fat. So, ang stool nato ani kay fatty. So, natay absence of pancreatic enzymes, no? impaired pa jud ang absorption sa fat, which causes impaired absorption sa fat, and munang magka fatty stools ta, or what we call steatorrhea. Azoturia naman ang tinatawag nating false mouth. So, biliary obstruction during fibrosis. So, biliary, we talk about the liver involvement. Skeletal system involvement. Napoday skeletal cystic fibrosis, no? Difficult absorption of vitamin D and calcium. So, retardation of growth and puberty onset, delayed bone aging, and shortness of stature. Reproductive organs. So, because the excretory manggod na system. Okay. Late menses, possible infertility, sterility but not impotency. What does sterility mean? Mo erect jahapon, but pilit lang kaayo ang secretions causing sterility. What does sterility mean? Pilit kaayo, like pain ba na? So, we move on na din sa cardiovascular. So, that's all for cystic fibrosis. How many minutes? So, cardiovascular is kind of lengthy because we have two kinds. We have acyanotic and cyanotic. So, under the acyanotic, we have two, and other we also have two, which is the rheumatic and Kawasaki. Sa acyanotic, we have ventricular and atrial. While sa cyanotic, we have the tetralogy of Fallot and the transportation of great aorta. So, laboratory tests and findings para sa, actually, hindi pa ta sa cardiovascular system. Nabagyapon ta sa cystic fibrosis because ang cardiovascular system maapektuhan pod when a baby has cystic fibrosis because congestive heart failure siya, resulting from obstruction of pulmonary blood flow. Mag-constrict ang heart, no, dayon ma-obstruct ang pulmonary blood flow, which paadto ang blood towards the lungs and to make it be oxygenized. Laboratory and diagnostic test, we have the sweat test. Unsan pag-perform sa sweat test? Unsa yang ma-reveal? So, iyang ma-reveal nga elevated chloride levels above pasingoto na to siya. Elevated dayon ang kanang sweat niya makita na to nga elevated above 60 MEQL. Then nana dayon siya what we call na cystic fibrosis. So, the production of sweat is stimulated. Pilocarpine iontophoresis. Pilocarpine. What is pilocarpine gani? Sweat electrolytes are measured. A minimum of 50 grams of sweat is needed. So, a chloride concentration higher than 60 is a positive test result. Higher than 60, guys, positive test result na siya. Higher than 60 MEQ, positive test result. So, complications, napajud tayo respiratory. So, additionally sa lips, napatay mga skeletal, sweat glands akong giingon ani no, napatay skeletal, cardiovascular, sa pa to? Reproductive organ, and now we also have respiratory. So, of course, respiratory man jud ning cystic fibrosis. Magka-cause siya COPD, pneumothorax, pneumonia, respiratory failure, cor pulmonale, right-sided heart failure, cor pulmonale day ang tawag sa right-sided heart failure, and hemoptysis. What does hemoptysis mean? It's something with the blood. Okay, hemo. Cor pulmonale or right-sided heart failure is an enlargement of the right ventricle due to high blood pressure in the lungs. So complications, GI complications, we have cirrhosis, esophageal varices, fecal implications, enlarged spleen, cholelithiasis or gallstones, pancreatitis, prolapse rectum. So esophageal varices, cirrhosis. Endocrine. Complications, we have diabetes mellitus, heat prostration, heat exhaustion. So, daghan jud kay siya no kay apil pa sa magka-cause pod siya cirrhosis sa GI. Dayon endocrine pa jud magka-diabetes siya and heat prostration or heat exhaustion. Oh my god, nagka-heat prostration siya. So, comment down below if I will ask you what does heat prostration mean. So, nursing diagnosis is activity intolerance related to imbalance between oxygen supply and demand. Ineffective airway clearance, intervention na to ana kay nebulize and chest tapping. Risk for infection related to stasis of respiratory secretions. Imbalanced nutrition less than the body requirement related to impaired digestive processes. So, high calorie, high protein, high fat diet. Provide adequate rest period. So, medical management. How do we have medical management? So, administer pancreatic enzymes before each meal or snack. Provide frequent nebulization or aerosol therapy, followed by chest physiotherapy. Provide water, miscible, vitamin A, D, and E. Nganong dili man tag fat soluble? Because dili siya maka-absorb og fats. Administer pancreatic enzymes before each meal or snack. Provide frequent nebulization and water miscible. Child and family education. Prepare the child and family for possible lung transplant. So kailangan jud kayo kay gawas ni sa exam nga unsa may nga kind of food na imong ihatag sa tao nga naay cystic fibrosis. So high calorie, high protein and high fat diet. And we also provide adequate rest period. So provide water, unsa ni miscible? Miscible vitamin A, D and E, which is katong fat siguro, addict ba? Ngano dili man tag fat soluble? Also non-fat soluble ni siya because dili siya maka-absorb water soluble daning addict. Di siya maka-absorb og fats lagi ang kuan. Ang katong cystic fibrosis. So kani meaning sa varices, mga varicose. And unsa man natong i-educate sa family ana, prepare the child for possible lung transplant. Now we go over na jud sa respiratory system and it's been 20 minutes already. I mean sa cardio. So again na breakdown na nato sa ang cardio and it has two types. Although decreased oxygenated blood delivered to the body, enough ra to siya na to cause cyanosis. Munang acyanotic ang isa. Although decrease ba ang oxygen nga magto sa body. So let's go over again sa how the blood works. So from unoxygenated blood from lower extremities, maato siya sa inferior ug superior vena cava, then maato siya sa right atrium, right ventricle, then pulmonary artery, then mo go siya for lungs for oxygenation. Then oxygenated blood goes through the left atrium, left ventricle, then mo ato siya sa aorta to be transmitted to the body. So kung sa normal nga adult, but kung ato siya sa aorta, mobalik siya sa umbilical vein, dayon ato siya sa sanang DV, ductus venosum, dayon ato siya sa naglibog ko sa right ventricle, pulmonary artery through the pulmonary. So, muna ha, i-memorize how baby. So, naman natato sa akong isa ka, PPT. So, first is ventricular septal defect. So, abnormal opening between the left and right ventricles. So, nganong nag-open man ang left and right ventricles? Kung sa tetralogy follow pata kay nagka-increase iyang dire, causing obstruction here. But, what does it cause? Mo na siyang meaning. Nabe ventricular septal defect ang kuan. Mag-mix right ventricle, we must remember nga kani right is unoxygenated, then kani ang sa oxygenated. Mag-mix ang duha because naay bangag ang left to right. Unsa may nakag-cause this sa bangag? I don't actually know. So, unsa mahitabo kung naay bangag? The oxygenated, maagto siya sa unoxygenated because there is less high pressure sa left side because mo pump siya harder to the aorta. So, pag pump niya harder, mabalhin siya diri. So, for the aorta to supply the system, whereas ang right ma-push siya to the lung, so less ang pressure. So, if naay bangag, mo siya sa left to right because right hyperventricular. So, this causes right ventricular hypertrophy. So, nganong magkakos siya right ventricular hypertrophy? Kaya ning dako na gani siya. Mudako siya because mas daghan siya i-pump. So, most common congenital heart defect is the ventricular septal defect. So, blood shuns from the left to right. So, you are going to be asked in the quiz, what is the most common ventricular septal defect? This is going to be the congenital heart defect. So, blood shuns from the left to right. Pressure in the left. So, muna to itong gidiscuss kanina. Blood that should go in the aorta and out to the body is shunted back into the pulmonary circulation, resulting in increased pressure in the pulmonary artery and right ventricular hypertrophy. So, overload and failure. Ngun si ma'am nga mugawas daw ni pero wala mugawas. So, kung sa ventricular septal defect, mag-increase ang pressure to the pulmonary artery po di ay. Increase ang pressure sa pulmonary artery and magkakos siya og right ventricular hypertrophy. So, how do we diagnose? Decrease ubos ang cardiac output, ineffective cardiopulmonary and peripheral tissue perfusion. So, dili siya mag-perfuse properly. Then, magkakos pa dyan siya fatigue and risk for infection. So, how do we manage this? Some VSDs close spontaneously. So, spontaneous lang. Mawala ra siya kalit. But some VSDs require open heart surgery before 2 years of age to prevent pulmonary hypertension. At sa pagganito, sa myringotomy, mampudguro to nga kailangan, or sa, dito sa eye defect, kailangan nga, kuan paghihapon ka kanang, kailangan nga 2 years of age, masurgeryhan na ka para dili mawala, para makorek ang strabismus. So, diri pod sa ventricular septal defect, kay open heart surgery should be done before 2 years of age to prevent pulmonary hypertension. Kay gibalik sa pulmonary artery ba ya? So, after cardiopulmonary bypass, the edge of the septal opening are approximated and sutured. So, after ma-bypass, mawala mas kurang bypass, the edge of the septal defect are approximated and sutured. So, if the defect is large, elastic or dracon patch is sutured in place to occlude the space. So, with time, septal tissue will grow across the gap and completely knit the patch in place. So, atrial septal defect. Abnormal communication between two atria. Oh my gosh. So, nanapod sa taas, no? Unsa may buhaton di ay kung gamay ang patch. Ay, gamay ang kuan. So, ganing meaning sa bypass pod. Like mo, lahos bitaw siya mo skip. Elastic dracon patch is sutured in place to occlude the space. If dako jud kayo ang kuano, bangag na nahitamo. Oh, okay. So, buslot between sa results from foramen ovale did not close during sa pagpanganak, which mo close dapat siya first breath of life. Paghilak mo close na ang kuan kaning atrial ang atrial. So pagpanganak na to sa DR, no, hala na close na dayon din ni iyang atrial septal. So blood flow is from left to right, oxygenated to deoxygenated. Extra blood from the left artery, volume overload of both right atrium and right ventricle. So ventricular hypertrophy, increased pulmonary blood flow. Ventricular hypertrophy, increased pulmonary blood flow. What does that mean? Increased pulmonary blood flow. So, pressure sa PA, systolic murmurs between the second and third intercostal space. So, ventricular hypertrophy, what does that mean? Dako ang sa right side. Increased pulmonary blood flow. Okay, pressure sa PA, same rig hapon. So, ang difference lang nila kay natay assess diri nga harsh systolic murmur heard on the pulmonic area. So, second and third intercostal space diri makadungog tag heart murmur due to extra amount of blood crossing the pulmonic valve. Blood cross. So, echocardiography with Doppler. Enlarge right side of the heart. And increase pulmonary circulation. Increase ang pulmonary circulation. So, cardiac catheterization to measure pressure and blood flow in the heart's chambers and large arteries is a cardiac catheterization nato siya. So, katong ventricular, dacron patch nato kaning sa kaning sa atrial septal defects kay atong cardiac catheterization. So, how do we diagnose this? We have ineffective cardiopulmonary and peripheral tissue perfusion, fatigue, and activity intolerance. Nga namang, same magyapon sa isa, then fatigue and activity intolerance. Di siya makakuan. So, medical and surgical management. So, surgical closure or patch, elastic or Drackian gihapon. Important to be repaired in girls because it can cause emboli during pregnancy or blood clots. So, kung mga panganak, dili ka mamatay kung nakailani, no? So, but makakos siya embolus mo adto diha, no, ang blood clot, then obstruct. So, repair, this is how it is repaired. So, pwede ta malanta og surgeries sa online kung giunsa nila jud pagkuan. So, last na sa direta sa patent ductus arteriosus kay apil pa ba ni apil pa ni siya sa cyanotic rather. So, for ductus arteriosus, between the pulmonary artery and the aorta. So, pulmonary artery kani and the aorta kani. So, vessel connecting aorta and pulmonary artery. So, kani. Mo man ni ang pulmonary artery. So, naday vessel, no, mag-connect sa pulmonary artery ug sa kuan. Muna na patent ductus, which ma-close na lagi na siya during birth. So, ductus arteriosus, sorry, pulos, nganong gihimo ni mo, Lord, nga naay connection sa vessel connecting aorta and pulmonary artery. So, thank you, Jesus, for making that. But please give me the reason why. Nganong nagbuhat ka ilanam. So, ductus arteriosus is an accessory fetal structure that connects the pulmonary artery and aorta. Closure should be with the first breath. So, normal heart is the pulmonary artery null to lungs. The aorta to the body, right atrium, the oxygenated blood, okay. While heart with patent ductus arteriosus, patent ductus, so mo din yung abnormality di ay ni. Pero yung naman siya mo close daw siya. Ligamentum arteriosum is here. But karon diri sa patent ductus arteriosus kay connected ang aorta ug kuan. So mixing blood from aorta and pulmonary oxygenated. So abnormality day siya, guys. Munang naglibog ko gamay ba nganong gihimo na ni Lord. Pero abnormality day siya. So DA remains open in fetal life is due to stimulation by prostaglandins from placenta and low oxygen in fetal blood. So pag breathe sa bata, gamay pa man siya oxygen, ma-increase ang oxygen pag breathe niya. Ang O2 count mo close dapat ang kuan. So patent ductus arteriosus is something okay ra siya kay hindi na to siya kailangan ng surgery sa sulod, pero kay kung ma-increase siya oxygen, pero open siya sa fetal life because of prostaglandin, so mabuhi rang bata jud. So after birth, when prostaglandin falls and O2 level increases, DA is stimulated to close naman. So muna siya, ductus arteriosus connects the pulmonary artery and aorta. So is this normal ba jud nga na? Is everyone having ductus arteriosus when they were a baby? So muna siya gibalik ra pud ang kuan. So oh my gosh, gistar ni Laura, so i-memorize data ni. Oh, so kani ang kuan ni pulmonary artery ang answer.